Well, hi there, Dr. Darrow.
Hello, Nita Valens. It's wonderful to talk to you today, and I hope you're having as good a day as I am, because I am living it up. What about you?
I love when you say you're living it up. It's so inspiring. I'm also living it up. How about that?
All right. Pretty soon we can have more people living it up.
That's right, because what we're talking about today is musculoskeletal pain, and we want you to give us a call at 866-870-5752. And what do we mean by musculoskeletal? We mean knee pain, back pain, arthritis pain, hip pain, joint pain. You get the idea. So when you call us, you have the chance to talk to Dr. Darrow directly about your pain. It's an opportunity I don't want you to miss, because chronic pain is something that if you've gone to the doctor and they send you to a surgeon and you're about to roll into an elective surgery, you might want to consider doing something a little bit less invasive. And that's what this show is all about. So do give us a call, 866-870-5752. Lines are open for you right now. And if you're just joining us for the first time, Dr. Darrow will explain a little bit more about the treatments and how that works in just a moment. I do want you to know when you call the program, you get a free book, Dr. Darrow's latest, and it's Stem Cell and Platelet-Rich Plasma Therapy, and the subtitle is Regenerate, Don't Operate. There's over 264 studies in this book, so you really want to take a look and give us a call. You also want to go to the website and check out what's going on, www.lastemcells.com. lastemcells.com. You can see Dr. Darrow performing the treatments on video, as well as being able to email him privately off of every page on the site. We are here at 10 a.m. on Saturday, at 1 p.m. on Saturday. And so now I'm turning it over to you.
All right, I'm going to go to a question that was sent out to me, and until we get a caller in her so we can talk to them. And like Nita says, please don't wait till the end of the show, because we get jammed with callers and we don't have time to talk to all of you then. So calling now is the way to go, and our number at the studio is 866-870-5752, 866-870-5752. So my first question goes like this, and by the way, people email me all day and all night long from all over the world, and I answer all of those. So if you are too shy to call in, I hope you're not too shy. But if you are, you can just email me through the website, which is www.lastemcells.com. That's lastemcells.com. And every single page on my website has a little place for you to email me. So the first question is, this is a great word, spondylosis/pars defect.
Ooh.
So what, yeah, nice, huh?
Yeah.
So spondylo has to do with the spine, and lysis has to do with cutting, and that means that there is what we call a pars defect. That's the pars interticularis. I know all these are fun words for you. Those are the connections within the vertebrae to hold them together. And very often there are people that have defects or fractures in the pars, and we find a lot of that with gymnasts and football players, obviously. Believe it or not, for some reason Eskimos have them. I don't know why that is. I've never looked that up.
Maybe they're tired of being cold all the time.
That could be. You never know.
Maybe.
So what it has to do with is pain in the low back typically, and I want to let you know, because of having a pars defect does not mean you have to have pain, but it could. And most of these pars defects that I find, we can heal the pain without fixing the pars defect. So don't think you need to have surgery to fix that. So let me read what the person wrote. I have a pars defect, or spondylosis. It has been slowly getting worse and is stopping me from participating in sports like squash, beach volleyball, and even ping pong. My questions are, would prolotherapy, PRP, and stem cells be likely to help this condition, or is there something else? What works the best? I'm starting to get mildly desperate. That's funny.
Mildly does. Is that an oxymoron? Just kidding.
Something like that. Yeah, I'm trying to think what figure of speech that is. So, we would check the body first, and what I have people do is people want to send in their MRIs or X-rays to see if I can fix them, and it's not really relevant. That's the point that's so crazy. People think that by sending in a film or an imaging that I can tell whether I can help them, and that's not really the case, because I like to look at the X-rays and MRIs or CT scans, but they don't tell me whether there's pain or not. It's adjunctive information to my examination. The exam is the big thing. So too often people come in after they've had a failed surgery, meaning they did have a surgery, it could have been on their neck or their back or their knee or whatever, and they didn't get better or they got worse. And I need to touch that area, and often I touch it and I find out that surgery could never have helped them to begin with because it wasn't a surgical issue. So be very careful not to allow your surgeon to cut based on looking at images. And I ask the patient when they come in after failed surgery, did the surgeon ever touch your body? And guess what the answer is? No. Yeah. Well, how did they know that they should be cutting? Because of looking at an image? No. Bad idea. So a lot of times it's what I call a red herring. The image is going to show something, but the image, number one, can be wrong because the MRIs, as an example, are overly sensitive, and many times they will show things like an ACL ligament in the knee, making it look torn when it really isn't. And then the surgeon will go in to repair it, and they're pretty shocked and find out that it is not torn. So be careful with all of this. And be careful just because you have something show up, like this pars defect that this person has. It may not be the pars defect that is causing the pain. It may just be the ligaments that are sprained. Most often, neck and back pain is just a sprain, like a sprained ankle. The ligaments in the ankle are sprained. Well, you don't run and get surgery because of a sprained ankle. I hope you don't.
No.
And it's the same thing in the neck and back. For some reason, the culture of our medicine so far has been to operate when people have neck and back pain when they shouldn't be doing it. And there's way too many failed surgeries. People have the surgery and it didn't work. And I talk about this on every show. There is a diagnosis, failed back surgery. What does that mean? Or failed back syndrome. It means that a surgery was done and it didn't work, and there are so many that fail that the insurance company actually has a diagnostic code to distinguish what happened. So be very careful. I don't believe in these surgeries unless it's absolutely, absolutely necessary. And what does absolutely mean? I don't really know, because people come in every day and say, I had to have the surgery done. I don't know why it didn't work. I had to have it done. The surgeon told me, or 3 surgeons told me I had to get it done. So be careful. If you're going to people that use knives, that's what the treatment's going to be. If you're going to people like me that use injections, that's what the treatment's going to be. Now, I was trained in my internship, and every free moment I had during medical school, I was doing surgery, and I loved surgery. I have to be honest. Back in the day, I was planning on being a surgeon, an orthopedic surgeon, until I had a shoulder surgery that went bad. And I don't dislike my surgeon for it. It's just that's what happens sometimes. We had a neurosurgeon on the show one time years ago, and I said to him, how often do your back surgeries and neck surgeries fail? And he thought for a second. He said, well, they only work about 50% of the time or less. And he was very cautious about this because he was a very honest person. And he said, before I operate on anyone, they have to come into the office 3 times. And I typically will try to talk them out of the surgery, and I make them bring their family in. He said, I only do the surgeries when I think it's absolutely necessary because there's too many failures. So please be careful.
Absolutely.
What do you think?
Yeah, I think you're right on it, and I think we have a couple callers. Would you like to go to Alan in Los Angeles?
I would, because Alan's got some knee pain. Alan, this is Dr. Marc Darrow. How long has your knee hurt you?
Yes, hello?
Alan,
Yeah, can you clear up your phone line? I don't know if you're on a speaker or whatever it is, but it's
You're echoing.
muddy.
Yeah, I was on speaker. Can you hear me now?
Oh, perfect. Thank you so much.
Better.
Yeah. I originally hurt my knee from jumping off of a bus, and I went to an orthopedic surgeon, and he gave me a brace to wear, and it got better. But I was really careful going down steps. I would go down steps backwards. And just recently, I crouched down on my knees and hands, and I hurt the knee again. And it seems like wearing a brace really doesn't help that much. And I was wondering if I should get an MRI, or I had an MRI last time, and I was wondering if I should get an MRI again. And will the injections, could they damage my knees if they don't help? And also, I was wondering if there's a website or I could find out people's testimonies, how stem cells have helped them.
Absolutely. Let me answer some of your questions, then I'll let you talk again. You can go to yelp.com, YELP.com, and put in Marc, M-A-R-C, Darrow, D-A-R-R-O-W-M-D, and it'll pop up. And there's several hundred reviews there that will tell you the good stuff and the bad stuff about these treatments. Most of it's good. I always get a few complainers, and I respond to them. And if you read a bad review, please read my response, because I'd like to write a review about those people, but I'm not allowed to. And we have something in medicine that is called HIPAA, which has to do with the privacy law of the patient. So I can't really respond when I get a bad review. I can respond, but it has to be generic and not about what really happened. And there's just some mean people out there, that's all I can tell you. And in the pain area, people get kind of crazy when they have pain, as you and I both know, because we've both had pain in our life, and it makes you very unhappy, and pain leads to depression too. So you can read the Yelp.com reviews that I have under Marc Darrow MD, and it'll tell you people's responses to the injections, what happens to them, what they go through, and probably take you a few hours to read all of them because there's so many of them. I've been doing this over 20 years. I think I do more than any other doctor on the planet. That's what I'm told when I go to national conventions and meet with a lot of people who do regenerative medicine using PRP and stem cells. And I don't really get people who say I hurt them. I typically get people that say that I helped them. But you should read up on it. And if you actually want to talk to my patients, we can give you names and phone numbers of people that are happy to talk to you. But number one, you asked about a brace. And the studies that are done about braces show that the results are very equivocal, meaning that some people say they help them, other people say they don't help them. There are studies with football players that show that they get worse injuries because they feel protected by the brace. I never give people braces, that's just me. I find that the braces are a money-making device for the doctors, and I'm into service, number one. I've got to make a living, but I'm not looking for gimmicks to make extra money on, and a lot of people are. So be careful of the braces. They're very expensive, and somebody's making money. When people ask about certain things, I go, follow the money and you'll find out what's really going on in any situation. I don't care if that's medicine or politics or whatever it is, it's all the same thing. So as to my prices, I am the cheapest guy I know of in the country, and some people call me up or email or come in and go, I don't know if I trust you because you're so inexpensive compared to everybody else, but I do enough so that it makes up for it, and I make a decent living doing this work, and I like to be able to charge less than other people, because these treatments honestly often and usually take more than one. It usually takes more than one treatment. And if you're going to someone who's very, very expensive, and I've seen a lot of doctors that charge so much, I don't know how they can sleep at night, because the patient's only going to be able to borrow money and afford to get one treatment. And honestly, one treatment is generally not enough. It may be, there are cases where it is, but usually it takes more than one treatment. So I don't know what else you would like to know. I think that we could probably, from what you're telling me, heal your knee using your own platelets from your blood or stem cells. There's two ways that I get them. One is from your bone marrow, and the other is by using umbilical cord stem cells. And either one of those I'm happy to do. Questions? Your turn.
When we're talking about cost, do you mean like thousands of dollars? Or?
Well, it's different for everybody, and I don't talk cost on the radio because everybody's got a different situation, but you can call up the office number right now and get an insurance verification, see if we take your insurance, at least covers the initial office visit, some of the procedures. And the phone number to the office is 800-300-9300. I'll repeat that for you. It's 800-300-9300. And there are people by the phones right now. If they're busy, then you can just leave your phone number and they'll call you right back. We do take Medicare and Cigna, Aetna, Blue Cross, Blue Shield, and United Healthcare. And for people without insurance, we take Care Credit, which is like a credit card for medical procedures, and we can help you get that immediately. So yeah, give a call to the office if you want to, and if you want to email me, go to the website www.lastemcells.com. That's lastemcells.com, and there's a spot where you can email me on every page, and I will either call you or write you right back. Okay. What other questions do you have about your knee, Alan?
I guess that covers it.
Yeah. So, and like everybody else, I'm going to tell you that you need to come in for an examination before I'm going to give you any definitive information, because just because you have an MRI from before or another doctor examines you and tells you something, I'm just going to tell you the truth right now, and I don't mean to be sounding like I'm egotistical, because it's not that. I just find that most doctors do very poor examinations and diagnostics in the musculoskeletal field that I work in. And most patients that come in have a wrong diagnosis.
Would you be the one that's doing the injections, or would it be somebody else?
So far, it's all me, all day.
It's all you? Okay.
Every day, yeah.
Okay. All right. I guess.
So, Alan, we appreciate your call, and if you keep listening to the program, if you come up with another question, just call us back.
Thank you very much.
You're welcome.
And thank the doctor, please.
Alan, you're a nice man. I appreciate your call, and God bless you.
Thank you. You too. Bye-bye.
Thank you so much. Our number is 866-870-5752, 866-870-5752. We're going to go to Carl in Arleta.
Hey, Carl, Dr. Marc Darrow, you have constant spasm in your buttocks and your hips. That doesn't sound like fun.
What happened a couple of months ago, and at 3 o'clock in the morning, somebody ran over me with a car. And I had this constant spasm in my thigh, bicep, my buttocks, and my hips. I belong to a health plan, and nothing they've done has worked whatsoever. I have had some supplements that have worked somewhat. They're slowly working. But I thought I would call you, having listened to you many times on the radio, and would appreciate any information you could give me about it.
Sure. Well, first of all, I'm so sorry you got run over by a car. That sounds
So am I.
terrible. And, it's one of those kind of things. It's a couple months ago. You still have some healing left, so that's good news. Yes. Hopefully most of it's gone by now, is it?
Well, I'll explain to you how flexible I was before that happened, because I've been in martial arts all my life. I could bend over with either leg straight, and I could touch my chin on my toes without any problem whatsoever. Now it's extremely difficult to bend over, but I have been taking some supplements that